Hi, I'm Alice. I'm a researcher at King's College London, and we're here today to talk about some collaborative work between the Shore Recovery app and the Salvation Army using the app in homelessness services. So the work is funded by the Social Science Impact Fund at King's College London, which is an economic and social research council fund, and on top of that, Lee Ball from the Salvation Army also got some funding to provide iPads to services to support use of the app. So I'm here today with Paul and Mel. Do you want to introduce yourselves?
Hi everybody, my name is Paul, and I've got lived experience with substance use, and some experience of homelessness as well. I've worked alongside Alice and the other guys from King's College London on public and patient involvement over a number of years, so really happy to be part of the team today.
Hi, I'm Mel. I also have lived experience of alcohol dependence. I've worked on the Shore Recovery app from the beginning with Alice and the wider team, and I'm really pleased to be recording this video today.
Okay, so the plan for today is to first start with a little bit of background about the app, sort of tell you where the idea came from and why we decided to develop it. And then we'll talk about the development process itself and then how we improved the app based on user feedback. Mel and Paul are then going to give you an overview of the features that are in the app, and then we'll talk about the collaborative project with the Salvation Army, which is why we're here, and then some next steps to move forward with the project. So the Shore app originates from two validated and published patient-reported outcome measures that were developed at King's College London. So the first is the Substance Use Recovery Evaluator, or SURE, and that's a measure of recovery that looks at substance use itself, but it also looks at other elements of recovery. So for example, material resources, relationships, physical and mental health. The second measure is the Substance Use Sleep Scale, which measures sleep for people who use substances. So both measures are distinct from other measures in the field, as they've been developed with unprecedented input from people with lived and living experience of homelessness and substance use, and therefore they should be more reflective of people's lived experience and what's important to them, as opposed to what's important to clinicians, for example, or researchers. So after the measures were developed, they began to be used quite widely. In particular, SURE has been translated into over 10 languages, and it's been used as an outcome monitoring tool in services and by researchers as well. So both tools have also been used by individuals to track and monitor their own recovery and sleep. And it was at this point that people started saying, oh, it'd be good to have the measures in an app so that then they could monitor and track their own scores. And that's where the idea for the app came from. So I came on board at that stage when we started developing the app, and we used a user-centred co-development approach, and by that I mean that we worked alongside an app developer and people in recovery throughout the app development process. So we used the double diamond design process, and basically that has 4 key stages which are repeated in cycles. So we started with the discovery phase, and we conducted some workshops and some interviews with people in recovery, exploring their experiences of substance use and recovery, but also what they felt should be included in a recovery app. We then used this information in the second phase to decide what features would be included in the app. We then moved on to developing the app, and that was a collaborative process. So Mediway Ventures developed the back end of the app and the design, so they did all the technical stuff. And then people with lived experience, clinicians and researchers at King's developed the actual content which sits within the app. So once we had sort of an initial prototype of the app, we tested it out with people who were in recovery, and we got their feedback again, and we then changed and modified the app, tested it again, and this was in cycles until everyone was happy that the app was ready to launch to the App Store. So the app launched in 2019 on the Android and Apple App Stores, and it's available there now to download and use for free. So after it launched and people started using it, we conducted some qualitative research with app users to tell us more about sort of how they were using the app, what they liked, what they thought could be improved, and then we used the findings from this research to tell us how we could improve the app, and we updated the app based on this. and a new improved version launched in 2023. So now thinking a little bit more about who the app is for and the features that are in it. So who is the app actually for? So the app has been developed for people who are using drugs or alcohol, who are in recovery already or who are thinking about recovery. And it's suitable for people who are seeking information on harm reduction and or abstinence. So it's not a one-size-fits-all approach, and hopefully there's something useful in there for everyone, no matter what stage of recovery they are at currently. I'm going to hand over to Mel and Paul now, who will tell you a little bit more about the actual features within the app.
Within the app, we have the recovery tracker. You're able to complete SURE just by answering a series of questions. This will provide personalised feedback. It will collate scores and show your previous scores, whether that be weekly, monthly or yearly. With the updated version, you're now able to share across with others. You're able to set up notifications and reminders. We also have the sleep tracker. Like SURE, you simply complete a series of questions. It will also provide personalised feedback, create a graph for those that are a little bit more visual. It will provide previous scores, whether weekly, monthly or yearly. And you can also share your scores with others, whether that be key workers or loved ones. And also like SURE, you can set up notifications and reminders. The SURE app also includes a diary where you can log private thoughts and feelings. You can record appointments or meetings or anything else that's on your mind. You can save the diary entries and look back on them. You can now also add emojis, which is one of the updated features, and you can also share your diary with others.
Thanks for that, Mel. Just moving on to the artwork section, and the idea with the artwork section was somewhere again where we could kind of share resources with other people that are using the app. People with lived experience of addiction quite often like to express themselves in art and poetry and prose, and we thought it was a really good idea to allow people to submit ideas for their artwork to the app. You can find the address to send any ideas that you might have to, and then we would put it onto the app for other people to see and share. And quite often, like as you can imagine, it's quite uplifting and I think inspirational for a lot of people as well. So I think that it's a really nice thing to be able to share with the other folks that are using the app. Moving on now to the naloxone slide. Naloxone, as many of you may know, is a opiate reversal drug. It's quite an easy drug to use, but obviously for people without experience of kind of using injections or even just coming across somebody with is in overdose, they might be quite scared and unsure what to do. So we thought it'd be a really good idea to include some resources that are available around naloxone and also create a very helpful video that goes through the process of, reviving somebody from a opiate overdose using naloxone. Like I said, the resources are out there and we've got links to different resources, but it's something that's obviously quite pertinent, and at the moment, obviously, with synthetic opioids, it's also quite relevant at the moment, I think, to have this slide available. Moving on to the resources and research. Again, this is something where we wanted to kind of almost like a hive mind of people with lived experience, and people could submit resources. We obviously already had some that we were going to put up there, and we have an excellent book on there that's written by Joe Neal, and that's freely available for people to read. But we've also, over the years that the app's been in use, have collected a lot of resources and research around different areas of, areas that might impact on somebody who's living with an addiction at the moment. So, there's homelessness advice, there's advice about benefits, there was advice about COVID, obviously, when COVID was a problem. And it's just, again, something that we felt was too good to lose in a way. So we wanted to keep it available to people and that's just sitting there now as a kind of alphabetic-sized index of what you can find when you might need some help.
Thanks. So now just thinking a little bit more about the people that you work with and how and why we think the app might be useful to people who are experiencing homelessness. So as I mentioned, the SURE measure was developed in consultation with people experiencing homelessness. So their views on what a measure of recovery should include directly contributed to the content of the measure and the app. And therefore it might be particularly relevant to them. We also know from our own research that the SURE app is most useful for people who are early in their recovery journeys who are still using substances and thinking about recovery. So it might be particularly relevant to people who are accessing support around homelessness, but who are not necessarily accessing formal support for their drug and alcohol use. And finally, we know from some other research that we conducted during the COVID pandemic with people experiencing homelessness, that they often had access to mobile devices, but having data or Wi-Fi was often a barrier to the uptake of health technology like the SURE app. So that's sort of the basis of why we thought the app might be useful to people experiencing homelessness, so the people that you work with. And I'm going to hand back to Mel, who will tell you a bit more about the current project.
So an overview of the current project. Stage 1, to identify services. Stage 2, to pilot the use of the app in services. Stage 3, to gather feedback. Stage 4, to develop a toolkit. And stage 5, knowledge exchange. So the idea being that key workers will work with their clients, and then once we've got that feedback, we can then share it on with other people in the substance use industry. So thinking about how you might use the app. People could use this alone as a self-monitoring tool. It can be self-directed with support or guided and supported. By this, we mean that you can actually literally help somebody complete the measure within the app, or somebody can use the iPad and go to a quiet place and complete this themselves.
So once you're using the app, the second stage of the project will be to gather some feedback from you about your experience of that. So we want to gather feedback that looks at how you've been using the app, what's worked well, and maybe what hasn't worked so well as well. So this will allow us to identify any barriers to using the app and think about how these might be overcome, and also think about ways in which using the app in a supported way could be beneficial to services and service users. So the next steps are to download the app on the iPad when you receive it. So this should have been sent to you. If you don't receive it, please do get in touch and we can find out where it is. And then start using the app in your service alongside the people that you work with. Just to say that each service user can have their own SURE account, so you can log in and out of the app when you're using it with a different service user. We'll then book a date in with you to gather your feedback. It would be great if you could bring some service users along to that meeting so we can get their feedback as well, or you can pass along their thoughts if that works better. So that's everything from us. If you do have any questions at all, please do just send us an email. That's my email address there on the screen. And thank you so much for listening today and completing the training. And please get in touch, and we hope that the app is useful to you at your service. Thank you.